Imagine this. You've worked hard for decades. You've saved, invested, planned, and now you're finally stepping into retirement. But there's a twist, a silent, ever-creeping cost wanting your attention. Healthcare. You thought your biggest worry in retirement would be picking travel destinations or finally reading those books on your shelf. But healthcare, it can quietly drain your nest egg if you're not prepared. Today, we're diving deep into how to navigate healthcare costs in retirement so you can protect your financial foundation and your peace of mind. Let's get started. Part 1. Why healthcare costs are a retirement game changer. 1. Healthcare is unpredictable. Maybe you'll be healthy until age 90, or maybe you'll need surgery, long-term care, or expensive medications early on. Unknowns equals potential budget wreckers. 2. Costs tend to rise faster than inflation. Medical inflation often outpaces regular inflation. If your retirement plan only accounts for general cost of living increases, you might be vastly underestimating what healthcare will cost you. 3. It's not just medical bills, prescription drugs, dental care, vision, hearing. Oh yeah, and long-term care, nursing homes, home health aides. These can sneak up on you. 4. Medicare or equivalent doesn't cover everything. Many assume Medicare equals full coverage. Wrong. Gaps, copays, deductibles, premiums, and services not included can bite hard. 5. Longevity risks. If you live long, great. But living into your 80s, 90s, beyond naturally increases cumulative costs. More chance of chronic disease, more medical needs. Part 2. Key principles for managing healthcare costs in retirement. Now that we know why this is a potential landmine, let's talk about how to protect yourself. A. Start saving early and estimate realistically. Use tools or calculators that assume higher medical inflation, e.g. 5 to 6%, rather than 2 to 3%. Estimate your anticipated healthcare needs. Think worst plausible case and plan for that. Aim for a specific healthcare savings fund or portion of your retirement portfolio dedicated solely to medical expenses. B. Understand your insurance options in depth. If you're in the US, know exactly what Medicare covers and what it doesn't. Explore Medicare supplemental, Medigap policies, or Medicare Advantage plans. Compare premiums, deductibles, network restrictions. Outside the US, examine national health insurance, private plans, or hybrid models. Check for co-payments, caps, full coverage versus limited. C. Use health savings accounts, HSAs, or equivalents. If eligible, HSAs are a triple win: pre-tax contributions, tax-free growth, and tax-free withdrawals for qualified medical expenses. After retirement, they can help cover out-of-pocket costs. Use them wisely. D. Consider long-term care insurance. Long-term care can be the biggest, most unexpected cost. Insurance can be expensive and premiums go up with age, but so do the risks. Weigh cost versus benefit carefully. E. Plan for the worst while hoping for the best. Have an emergency fund specifically for health shocks. Consider annuities with riders for long-term illness or critical illness. Make sure estate planning, powers of attorney, and health directives are in place. F. Stay healthy. Invest in preventative care, regular checkups, screenings, good nutrition, exercise, mental health. The healthier you stay, the fewer medical surprises and lower costs. Part 3. Practical steps and tools you can use. Let's get real. Here are actionable steps to help you today so you're better prepared tomorrow. 1. Run projections with a healthcare cost calculator. There are online tools that let you estimate costs for different ages, health status, and inflation rates. Try a healthcare cost in retirement calculator and input conservative numbers. 2. Audit your current coverage. Examine your health insurance now. What are your copays, prescriptions, deductibles? What if you have a serious illness? What's your worst case out of pocket? 3. Compare options annually. Don't just pick a plan and forget it. Premiums and benefits change. Revisit your insurance, your prescriptions, your providers to see if there's a better deal. 4. Set up or reevaluate your HSA or equivalent fund. If you've got one, see how much you have saved. If not, explore options. Make regular contributions. Use it wisely for qualified expenses so you don't get taxed. 5. Calculate max exposure, worst case scenario. Sit down and write. If I get Alzheimer's, need a wheelchair, need major surgery, prescription meds, what could that cost me in 5, 10, 20 years? Do this math. It's sobering, but it guides decisions. 6. Talk to professionals. Financial advisors who specialize in retirement, insurance brokers with experience in senior healthcare, maybe even elder law attorneys. Their insights can help you avoid pitfalls. Part 4. Realistic numbers and examples. Because numbers hit harder, let's pull some examples. Let's say a couple retiring at age 65, estimate $300,000 plus in medical expenses over their retirement, just in out-of-pocket costs, premiums, deductibles, treatments. That's a lot. Prescription drug costs can increase steadily. A medication now costing $50 per month could cost twice as much in 10 to 15 years, with inflation and no insurance cost controls. Long-term care. Staying in a nursing home or hiring in-home caregivers can cost $5,000 to $8,000 per month or more, depending on location and services. These aren't doomsday numbers. They're what many people face. The difference between someone who planned ahead and someone who didn't can be hundreds of thousands of dollars. Part 5. Mistakes to avoid. Don't let these common missteps drag you down. Underestimating how long you'll live. The longer you live, the more medical care you'll likely use. Thinking Medicare or public insurance will cover everything. Surprise bills happen, gaps happen, waiting till retirement to plan for health costs. By then, premiums are higher, insurability might be limited, options fewer. Ignoring hidden or indirect costs. Transportation, home modifications, caregiving, all of which may not feel like medical at first, but add up fast. Failing to review your plan yearly. We already said this, but it can't be overstated. What was best this year might be overpriced or less protective next year. Retirement isn't free, and healthcare could be your biggest cost, hiding in plain sight. But it doesn't have to rob you of your freedom, your dreams, or your legacy. With smart planning, realistic estimates, insurance wisdom, and a strong sense of your values, you can protect your finances and enjoy your golden years without that constant cloud of medical worry. So, what's your next move? Start the projections. Talk to a pro. Make sure your plan includes health, not just income. If you found value in this, hit that like button, subscribe, and ring the bell so you don't miss our dive into retirement income streams next. Let's walk into retirement strong, prepared, and ready for the adventures. You deserve that.